talking about ICU and infection, more from the perspective of the layman and the society at large as to what they believe is the risk of infection in ICU and how we deal with it. As an intensivist, a common question that I'm often asked by the relative of the patient is my patient in ICU likely to contact an infection? So there are actually two components of this question which they themselves don't realize. The first part is they're asking whether the patients are at a higher risk of having a cross infection from other patients in the ICU. But the other aspect which they themselves are not aware is that the patient in ICU, because of the host factors, is at a higher risk of infection. So the answer cannot be no to either of the two aspects of the question. But when it comes to cross infection, the risk definitely is higher than that what it is in the society, but is not alarming. So we all are aware when in the society, when somebody in the family gets a viral fever, other members of the family also at times contact viral fever. So that spread from a person to person can happen even in society. In the ICU, the risk of this cross infection will not be very higher than that in the society at large, provided the ICU has a good infrastructure, a good infection control policy, and all the standard precautions are taken, which I'll discuss later. Coming to the second part of the question is whether the ICU patients are at high risk of infection per se. That is because of the host factors. So most of these patients have multiple comorbidities. They are on multiple antibiotics, hence they are more susceptible to multi-drug resistant organisms. They also have immunosuppressive status. It might be because of the comorbidities, it might be because of the steroids, or because of the severe sepsis that they already have. The other thing is there might be invasive monitoring apparatus attached to the patient. There might be different tubes and lines which per se increase the risk of infection. So how do we decrease it? The methods to address both the issues, either of cross infection or de novo infections, are similar. So we need to have a basic understanding of how does the infection spread. So it is either directly by contact, by aerosol, when the particle droplet size is more than, droplet infection when the particle size is more than 5 microns, or by airborne when the particle size is less than 5 microns, and it can also be because of the various tubes and lines that the patient has. So coming, the first thing that we can change is having a good infrastructure. So the distance between the patients should be more. So in an ICU where the patients are clubbed together, the distance between two beds is not much, the risk of cross infection is higher. So having a well-spaced ICU with proper isolation, with walls between patients, so that the droplet infection is much less, the contact is much less, goes a long way in preventing cross infections. The second would be the manpower. So in the ideal world, having a 1:1 nursing is the best way to prevent cross infection. So the healthcare workers are not moving from one patient to the other. The third thing comes hand hygiene. So using of standard barrier nursing, using standard protocol, where every time you touch a patient, before and after, you're supposed to wash your hands. The technique of hand washing should be also correct, because just hand washing when the technique is wrong does not help much. That is very important. Third is disinfection. So whenever there are equipments, which even though nowadays we use most of the disposable consumables, there are times that some equipment need to be shared, like the ECG machine. We cannot have a separate ECG machine for everyone. Like the ultrasound machine, we cannot have that for everyone. So that does move from patient to patient, but proper disinfection while using from one patient to the other helps in prevention of infection. Using proper probes while doing some invasive lines is very important. Use of personal protective equipment is also important, like gloves, gowns, goggles when you are using where there's a risk of droplet infection helps a lot. And the third thing would be proper injection hygiene. So while preparing medication, administering medication, we have to be careful that we do not introduce infection into the patient directly. Care of tubes, making sure all the connections are airtight, not exposed to the environment, and there is no risk of infection being introduced directly into the bloodstream or other body spaces is also very important. The third thing is proper use of antibiotics. That is where the antibiotic stewardship comes into play. Using the least amount of antibiotics, the narrow spectrum antibiotics, de-escalating on time, readjusting once the cultures are back, and stopping antibiotics. Many a times the course, in some practices, people tend to use prolonged antibiotic. That again is not a great idea. And the most important is having good awareness and education of all the healthcare staff, and having a close monitoring that the education level has not dropped, and there's proper surveillance as to whatever we are teaching and the infection control practices are in place, and having regular audits. So having a regular audit of what is the incidence of VAP in an ICU, what is the incidence of CLABSI, COTI, all that is very important, and we need to analyze those data and constantly look very carefully into whatever our data says and make sure that we keep it to the minimum. Zero infection is not a possibility, but we should try to make it as less as possible. Thank you.